it's a really safe space, and that's what they are reporting, right? People really feel comfortable, I think sometimes too comfortable. This program, you can tell, is really about them. It was designed for them to meet their needs. The participants are very welcoming, and they make sure that it stays a respectful space for everyone.
Hello and welcome to Your Health Matters by Sorogi. My name is Dr. Okafor and today I'm your host. If you're new here, welcome. I encourage you after this episode to check out our recent episodes and follow us on our social media platforms at Sorogi Health. Now, today's going to be a very interesting episode. So much has happened since the last time we spoke, and I want to get you guys caught up on all things Sorogi, as well as the new updates that we have in store. This year has been really about growth and adaptation for us. Over the summer, we had the chance to continue engagement with our community through SnapEd classes, and we have a really exciting guest today who needs no introduction, Dr. Ayub. Dr. Ayub, welcome to the podcast.
Thank you, Dr. Okafor. It's a pleasure to be here today.
Excellent. And you're always a friend to the room, but I want to get started. So, can you provide us an update on what has been working this year and give us a recap of the summer activities, including SnapEd?
Sure. It's really been an exciting year at Sorogi. So, two big things I wanted to touch on. The first is the new programs that we launched this year, and also the changes to our Sorogi Health platform. So, starting out with the programs, we launched two new ones, the Peer Support Weight Loss Program and the Supplemental Nutrition Assistant Education Program, which is
Wow.
commonly referred to as SNAP-Ed. With the Peer Support Weight Loss Program, it really came about from our participants sharing their concerns about wanting a separate space to discuss weight concerns, get personalized advice and recommendations from our team of experts, and also to be able to implement changes to their nutrition and physical activity routine in a way that makes sense for them and takes into account the resources that they have available to them. So we launched that with that in mind, and it has been a success so far. Now, the SNAP-Ed program is brand new. We got some funding from DC Department of Health. DC Health reached out and we applied for a grant, which we received. And the goal of the SNAP-Ed program is to provide education around nutrition, give the residents of DC an opportunity to learn ways of increasing their consumption of fruits and vegetables. So it has been so much fun bringing that program to the residents in Ward 7 and 8. And part of that too is an opportunity for them to participate in more structured exercise classes. So two fun things that have been going so well in terms of programs. And the last thing I want to mention in terms of updates this year, something that's really big, a major change we made this year was updating our Sorogi Health platform. So Sorogi Health is a means for providers to refer patients to our programs. It also allows residents to self-register and access all the classes that we have, right? And for providers who use the platform to refer their patients, they can always come back as bi-directional and see how much change their patients are making outside of the clinic, right? Are they engaging in physical activity? And what are some of the nutrition education they are getting and how are they using that, right? They
Right.
can get more insight on what's going on outside of the clinic. And our goal is that this would create meaningful conversations when the patients do come back for follow-ups with their providers and will allow them to optimize their care for their patients. So that's what the platform is supposed to do. So this year, we got a lot of feedback from our participants and we engaged with subject matter experts who are really good in this work. And I'm happy to say that the platform that we launched this year, or the updates to it, makes this platform much more agile. It can really take care of the needs of our clients and also the growing demand for the services that we provide. So that's just a few things that we've been working on this year and super excited that it's all going well.
Right. And that's truly amazing. I had the opportunity to really work behind the scenes and see a lot of the changes with Sorogi and increasing the connection with participants and being able to provide so many resources is such an amazing opportunity. But I wanted to also ask you, how have we acknowledged these challenges? I know we have a couple of challenges this year with Sorogi due to funding cuts, but in what ways have we restructured it due to this response?
Yeah, it has been challenging. We've made a lot of progress. That has not come with its own challenge, right? In the current climate we live in, there's a lot of cuts to grant funding, which allows us to be able to provide a lot of our programs at reduced cost or no cost to the participants in underserved communities. So grant funding is really important and crucial to the work we do. And due to the cuts, right, in the current bill that was passed in Congress this year, that funding is under threat. I don't think we're still going to have it going into 2026. And we are worried that that would make some of our programs out of reach for those who truly need it. But that being said, we also are dealing with other challenges such as referrals to our programs. And I'm talking about provider referrals to our diabetes self-management program or the diabetes self-management, just to name a few. And this is not just something that's unique to Sorogi. It's a vexing problem that exists nationwide. There are limited number of referrals that programs like that receive to be able to sustain them long term. Now, despite these challenges, I do believe that the work that we have been doing at Sorogi for the past 2 years in finding ways to reduce inefficiencies in our programs has really set us up for this moment. So we have been able to automate things that need it and where it makes sense, making sure that whatever time is available is spent personalizing the care to each and every one of our participants. So taking out inefficiency or finding ways and eliminating that has set us up for success. In addition to that, we have been working really hard to make sure that our staff really reflects the community that we serve. Trust is very important in the work that we do. And it is important that you get the message and the messenger right in the first place. We have been working really hard to make sure that that's in place and will set us up for these challenges that are ahead of us. And finally, we have also taken another look at the partnerships that we have in place. As a young organization and a company, it's easy and tempting, right, to want to partner with anybody when you're starting out. But we're finding out that that is not always in the best interest of our client or our organization. And this is lesson learned the hard way. We have ended up in bed with some strange folks that have not really on paper, I'm serious, on paper look like would be a great partnership, right?
Mhm.
But when it really mattered, we are finding out that they do not add or contribute in a significant way, nor do they really share our values, right, in moving our mission forward and helping us achieve our goals. So, serious, shared
Wow.
space is not necessarily shared values. And they said, lesson learned the hard way. And as we move forward, especially in this challenging time, we are vetting all our partners, both at the local and national level, making sure that truly there is shared value. We can all work together towards achieving the goals that we have for our company. So, those are just a few of the things that we're doing in terms of changes to the way we run our programs, also making sure the staff is the right one to meet the needs of the community and making sure that we're moving along with partners that truly add value. I think all these things will help us weather this storm.
Wow, and you're definitely right. It's very interesting. Different partnerships may have different missions or may not align with Sorogi, and that's really important to us, right? We want to value what our participants believe in, what we're bringing to them in terms of resources and access. So I definitely want to switch gears a bit. I want to talk more about the summer program we had, and I want you to tell me more about which part of the summer program resonated most with participants. I know we had a really increased amount of people joining this summer. So which part of the summer program resonated most with participants?
I honestly believe that the in-person cooking demonstrations
Mm.
have been what participants have truly enjoyed. The fact that we can come together in person, they can meet the registered dietitian, get their questions answered, participate in all these wonderful activities where they are learning new ways and practical ways, right, to be able to make healthy eating fun. I think based on the feedback that we're hearing that that's something that was needed and people are really, really enjoying that. Also, we've also had the opportunity to increase in the number of sessions for physical activity. That is also something that the participants like and appreciate. So those are just the two that I can think of right now.
You know what just came to mind? The recipes. I know the brownie recipes are something that they just love so much. And I think that's also another great factor. I think that resonated a lot with participants, the knowing that the recipes were accessible, easy to make, and something they can see live and in person and just really be able to ask questions with, be able to duplicate it back at home with their families and share the recipes while bringing new participants to the program every other week. So that's also another amazing, exciting aspect. So were there any unexpected success or moments that stood out to you with the program?
Actually, there were several. The first one, honestly, not necessarily a moment, but something that really happened that was a true joy to the team. That's the level of engagement. So you plan for this, right? And you hope for it, but it is such a beautiful thing to see it happen. All the participants love coming out, right? To join in the cooking demonstrations. You already mentioned the recipe. They truly like it. What we've found really surprising was that they're telling their neighbors, they're telling their friends, and they're making sure that they are coming to these events. We now have our own Sorogi Aunties network, right? They are serious. There's are just wonderful, wonderful ladies in the program. They are making sure their neighbor is aware of the program, when it's happening, and they show up wearing their Sorogi t-shirts, okay? And they're not playing. So I have been surprised by how much engagement we've had in it, and it's a good thing. It really is a good thing. And again, it's not just the engagement, it's the hope that is given folks in the community. Right? So it's one thing to hear a registered dietitian or pharmacist or your certified diabetes educator say that, this is going to help improve your health. It's something else when you actually see it happening for your neighbor. Yeah, they're coming out and they're telling all their stories, all these wonderful testimonials that we're getting every week has really made people believe that implementing the small things, right, making the small changes and sustaining it for a long period of time can produce good results. So it is a good thing to see that. And finally, it's not just the community members who have been truly engaged. Providers are also getting in on the fun as well. I am not sure how this happened, and I'm referring to prescribing physicians. I'm not sure how it happened, but with one of the with one of the FQACs that is in our area, someone mentioned our name in their internal chat group. I did not know physicians had a chat group, but I'm learning. And based off of that, we have seen a spike in the number of referrals coming from this particular organization. So I want to take a moment to give a shout out to Unity Healthcare in Washington, D.C. Their providers are wonderful, terrific, terrific humans. And we have loved working with them, and we are grateful that they trust us with their patients. If I had known that there was an internal chat group and that's what was needed to increase referrals, we would have gotten it a lot sooner. But super
Right.
grateful, happy that they trust us, know that we exist. They get the mission, okay? So
Right.
we are truly excited and look forward to more referrals from our community and all the providers in the DMV area.
Well, that's exciting. A whole group chat.
A whole group chat.
But I wanted to ask you, and that's really amazing the fact that we have providers helping out and referring. I think that's such an exciting opportunity for new people to join our program. I wanted to ask you really just more about the changes we made to the program, right? So, how did these changes impact participation and outcome?
A lot of the changes to our program have really come from listening to our participants and our partners in the community. So we don't take it for granted when people share their feedback with us because it gives us an idea of where the needs are and also the gaps that we need to fill. So based on that, we have been able to implement changes that has resonated with the participants or just the community in general. So we have a continued quality improvement process and feedback from residents, providers, and I said just our partners is part of that process. So I'd say that has made a big difference because we have quick ability to change and adapt based on the needs. And people are grateful for that because they're coming into programs that they can tell is relevant, is practical, and is effective, and it meets them where they are. So people truly, truly appreciate that.
That's just amazing. I think that being able to provide all the resources and give back in multiple ways and having those partnerships is truly echoing what we value at Sorogi.
It's
More about
true. If I could just add something else to that, no, you make a very good point. And I'll say our participants are grateful for this, right? The fact that they know that we're listening to them and they're contributing, right, in shaping the programs, they feel like they have a stake in this, right? Everyone believes that they are a part of this, and they feel like they need to make this work, right? Everybody is doing their part to make sure that our programs are a success. And you feel it when you show up at any of our virtual or in-person sessions. You can tell people take great pride in what we are offering because they know that they help make it come to life, right? They know that we're listening to them and this program is truly about them.
right.
It's a really safe space, and that's what they are reporting, right? People really feel comfortable, I think sometimes too comfortable. This program, you can tell, is really about them. It was designed for them to meet their needs. The participants are very welcoming and they make sure that it stays a respectful space for everyone.
I love that. And I think for me, and just my personal viewpoint, I love seeing the participants tell about their wins, their lows, and just being transparent with one another and being able to connect with them and share any new events that's in the area and just connect with them on a deeper level, having a common thread. I think that's building that community aspect is something Sirogi really fostered. And that kind of leads me to my next question. So, how did we gather feedback from participants about the program?
We have in our programs regular surveys. Every 3 months interval, there is a survey that goes out. And also at each encounter, right, where we're asking those questions, how are you doing? What's going on? How can we make this work for you, right? So those
Right.
opportunities for us to figure out what's working and what's not. So if you look at that and we identify a common thread or a common need, we make sure we jump on it right away and be able to address it by making changes to the program or making sure that if it's something that's lacking, we get the right team member or we make changes to a staff and hire the right person to be able to address that need. So we are constantly listening to our participants and making sure that whatever we are doing, right, makes sense for them and this program truly address any needs and gaps in care that do exist. So those surveys are very, very important to us. We are always making sure we're looking at them and we're always finding ways to make changes to our programs to address needs in the community.
Excellent. And now I'm just also wondering, I talked a little more about the aspect wins and lows, but can you share any participant stories that kind of illustrate the impact of the program?
Let's see here. I'm thinking of this one lady who just joined our diabetes self-management about 3 months or so. And she reached out a few weeks ago, sharing with the team that her doctors told her she needs to lose 40 pounds or so. But what was very frustrating for her was there was no plan, right? She knows she needs to lose 40 pounds, but no one is really giving her an idea of how she's supposed to do it. So she was very frustrated, had a lot of anxiety when she called our organization. And when we talked to her, we showed her what we had to offer and how we were going to work with her, she was so happy because one, she felt like she now has a plan. She has folks on her side who will help her along this journey. It gave her peace of mind and really made it possible, right? She could now
Right.
see a pathway towards achieving her goal. And that was huge, huge for her. And those are the kind of things that really bring to light the gap that we're feeling in the community and some of the things that we can do to assist providers in caring for their patients. So I think that was a really big moment, not just for myself, but also the interns and everyone else that really illustrated the work we're doing and how we are helping close gaps in care.
I know that last month was social connection. We focused a lot on social connection. That was our big theme. And this month we're focused on rest and reset. So how did that tie into Sorogi's mission?
We're a company that promotes health and wellness, right? And part of that is rest. If we cannot do it ourselves, how are we supposed to help others? So we practice what we preach. So charity begins at home, right? You really need to practice what you preach. So at Sorogi, we take rest really important, and we try to make sure that during the summertime is a moment where we step back, we look at our surveys, we reflect, and we plan for the fall and beyond. So rest is really important, it's built into everything we do. We want to make sure that our staff take the time they need, right, to be able to recharge, come back, and give their best to our participants. Because this job, it can be tough some days. So we want to always be checking in, making sure that we are supporting everyone in our organization, and that includes making sure everyone is able to take the time they need, recharge, and come back and give their best.
Nice. And I know you kind of answered this a bit, but I want you to really expand more on the aspect of, so why is it important for both providers and community members to pause and reset?
It is, but by that I mean, taking time to rest, acknowledging what's going on, right? And some of the stress and challenges, and connecting with people in the community, making sure that you have what you need to succeed. And this is the same for providers. They're humans and everyone else in the community. So burnout is real. For providers, we cannot stress that enough. Burnout is a real thing. And we want to make sure that our providers know about our programs, how we can help them reduce some of the stress and they might be facing, right, in trying to care for their patients. They didn't know that Sorogi is a partner there to help them. They don't have to do this alone. And again, you cannot give from an empty cup, right? There's that old saying. So, in order to give your best, we make sure that providers are also taking the time to be able to rest, engage in activities in the community that bring them joy, spending time with family and friends. All those things are really important in your overall health. It doesn't matter if you're a physician or a patient. That is just great, great way to make sure that you stay healthy.
Nice. So we talked a lot about the changes, right? We talked about all the changes Rogue is going through, the benefits, the ups, downs, and how we're trying them through. I want to ask you, what should people expect from Sorogi in the incoming months?
Oh, lots of good things. Excellent, excellent programs, right? That is rooted in community values. Like we took the summer months to update our curriculum, make sure that it makes sense. It addresses the needs that we identified in the past cohorts. And I cannot wait to launch the new fall cohorts. And it's so many great things, right? So not just did we update our curriculum, we also made sure that we implemented some changes as well in the platform to make it easy for participants, right, to make appointments one-on-one with their favorite educator or registered dietitian. So they're going to have the ability to do that. Also, we are going to be adding new exercise classes. So we're going to have beginner sessions and we're going to have advanced sessions as well. So that should be fun. I can't wait for all of these things to come to be implemented starting in September. But excellent, just excellent programs scheduled and we can't wait. So keep the
Very
referrals
excited.
coming now.
I'm excited. And I wonder, you mentioned about referrals. How can providers, partners, really the public get involved and really support the next phase for Sorogi?
Sure. For all the healthcare providers in the DC metropolitan area, I just want to let you know that Sorogi is here. We are your community partners. You don't have to do this alone. So every patient of yours who is newly diagnosed or experiencing complications or just need assistance understanding what's going on when it has to do with diabetes, hypertension, weight loss, send them our way. The referral process is pretty easy. You can do it online, you can fax it. Sometimes just a phone call is okay, and we can start the process. So there's so many different ways, right, to be able to refer your patients. But the message is that you are not alone in this process. You have an amazing partner in the community that would take really good care of your patients, make sure that they have access to the education and the resources they need to do well. And for everyone else who's been diagnosed, right, you can self-refer into our programs too. And for all our aunties and uncles who are caring for loved ones, right? We are here to help you as well. And for organizations too, I shouldn't forget about organizations who are trying to make meaningful impact in underserved communities. We have the capabilities to be able to design and implement chronic disease programs. So Sorogi really is your one-stop shop. I always say that if your faucet is broken, right, you need to call the plumber. But for diabetes, hypertension, and other chronic disease management and prevention, you call Sorogi. You don't have to go at this alone. We are here. Come join our community, get that
Right.
peace of mind that everyone else is experiencing, and let's get on this journey of improving the health of our communities one person at a time.
Yes, thank you. And on that note, thank you so much, Dr. Yu, for coming on the podcast today. It truly was a pleasure. Truly was a pleasure.
I am grateful. Thank you. Thank you, Gona. You're doing a really amazing job with the podcast. So I'm really excited to be here today. And I hope that anyone who is listening, right, if you have any concern or you want to learn more, please join us or contact us, social media, telephone, email, whatever works for you. We are here to listen and provide support that works for you.
Excellent. And yes, please follow us on our social media pages at Sorogi Health. We're on Facebook, LinkedIn, YouTube, Twitter. We're pretty much on all the social media platforms. We also have a new website design, as Dr. Ayuk mentioned, where we can provide feedback. If you have any questions about the podcast, any new topics you want us to talk about, let us know. We're happy to discuss it more on our podcast channel. And of course, as I said before, follow us on our social media pages for all the updates on Sorogi. Thank you guys so much and look forward to seeing you guys next time. All right. Bye bye, guys.
Thank you.